Hello and welcome to the third part of this chapter, which is the arthrokinematics of the scapulothoracic joint. First, this is a false joint, or what we call a pseudojoint. What does this mean? To understand what a pseudojoint or false joint means, we must know about a true joint first. A true joint is any synovial type joint where the two bones forming the joint are connected by a joint capsule lined with the synovial membrane. However, when we look at the ST joint, it does not have these characteristics. It is simply the sliding of the scapula over the thorax, with muscles separating these two surfaces, such as the serratus anterior muscle, the subscapularis, and the erector spinae. So again, this joint consists of just two bones with no direct contact between each other, separated by layers of muscles, without a joint capsule or anything else. A side note, this sliding of the scapula over the thorax, if there is malalignment and the scapula does not move well on the rounded contour of the thorax, you may hear an audible click during scapular movement. Moving on to the general features of the joint. First, when the scapula is in the anatomical position, it is positioned between the second and the seventh rib. As discussed previously, the wide range of motion available to the shoulder is due to the large movement available in the ST joint. The scapulothoracic joint has a significant influence on the kinetic and kinematic environment of the glenohumeral joint. Moving on to the kinematics of this pseudojoint. Let's first agree that the movement that occurs between the scapula and the thorax results from cooperation between the SC and the AC joints. The restrictions of motion at either joint can affect and limit the motion of the scapula and in turn the entire shoulder. Anyways, the movements of the ST joint are as follows: elevation and depression, retraction and protraction, upward and downward rotation. Let's first discuss elevation and depression. First, scapular elevation, or what we call shoulder shrugging. It's simply a direct result of the scapula following the path of the elevating clavicle around the SC joint, and a tuning rotation that occurs at the AC joint. Again, scapular elevation is composed of SC and AC joints rotations. First is the sternoclavicular joint elevation by clavicular elevation. Secondly, there is a rotation that occurs at the AC joint. You might be confused, but let me tell you that the rotation that occurs at the AC is downward rotation and not upward. You might ask how? Shoulder shrugging is done by elevation of the clavicles and scapula. How can downward rotation occur at the AC? Remember before when I told you that the AC joint is the tuner? To understand this better, imagine if there is no motion at the AC at all, and only the clavicle elevated through the SC joint, and the scapula followed with no modulation or modifications by the AC. What would happen? The scapula would not elevate purely, it would elevate in a curving manner. If you look at the clavicle closely, it didn't elevate purely upward. The clavicle is like a stick that was fixed from a point, which is the SC, and the other end at the AC elevated to create a small curve or arc of motion. So if the scapula followed the same path, it would elevate with the same small curve or arc of motion. However, this doesn't happen in normal kinematics. The scapula has the tuner option at the AC, meaning it can elevate purely upward without any angulation due to the slight downward rotation at the AC, allowing it to elevate near vertically in a straight manner. The depression of the scapula is the reverse action described for elevation. Moving on to protraction and retraction. First, protraction. Protraction is the combination of horizontal plane rotations at the SC and AC joints. Remember from before, horizontal plane rotation at the SC is the protraction of the SC, and the horizontal plane rotation of the AC involves fine rotational adjustments that occur in the horizontal plane. These two movements must occur to assist the final movement of scapular protraction. As usual, the scapula follows the path of the protracting clavicle at the SC joint, and the role of the AC is to either amplify, offset, or adjust the total amount of the scapulothoracic protraction by contributing with a varying amount of internal rotation to align with the rounded contours of the thorax as discussed at some point in the course. In summary, protraction of the ST is the combination of protracting the clavicle at the SC and internal rotation of the scapula at the AC joint to align with the contour. An important note is that a joint could partially, and emphasize on the word partially, compensate for the functional loss of the other. For example, if there is a condition that limits the motion of the SC, the AC could compensate, and vice versa. And as I told you, it partially compensates. As for retraction, as always, it is the reverse of protraction. Moving on to the last two movements of the ST joint, which are the upward and downward rotations of the ST joint. Upward rotation is an integral and main part of raising the arm overhead, as it positions the glenoid fossa to support and stabilize the head of the abducted humerus. The upward rotation of the scapulothoracic joint, a total of 60 degrees, cannot be achieved by the ST joint alone. It's also assisted by the SC and the AC through elevation. And as usual, the opposite movement, which is the downward rotation, is the reverse of the movement described. This involves a depressed clavicle at the SC, downward rotation at the AC, and the return of the scapula to the anatomical position. And that's it. If you have any questions, please leave them and we are glad to help. Thank you again, and final part of this chapter, which is the glenohumeral joint.